Hi guys, Dr. Corbin Pominville here. You're here because you're in pain and you haven't been able to solve it yet. This is because you haven't found the root cause of your pain. Pain is our body's way of saying there's a problem here. Almost always, if pain doesn't go away, it's because there's continued pressure on that area or compression on that area, that tissue. And that tissue in your body isn't allowed to heal up and feel better and less inflamed the way it should. So I put together a video with some explanations on the anatomy and what may be causing your pain to last longer than you'd like it to. Really hope this helps and gets you back to moving better, feeling younger, and being yourself again.
Hi guys, this is Dr. Corbin Pominville, and I'm back with our fourth anatomy series on back pain. I want to explain what's going on in your body and give you some answers as to why you may be having this back pain so you can understand it a little more. So let's talk about what is actually causing this pain. Number one could be repetitive activities at work. So say you're doing something like a manual labor job, the wear and tear from this or improper form could also cause back pain, especially if you have improper form over time. This can definitely cause it. Number two, something similar, is repetitive sports, exercise, or other activities with improper form. So usually your body is okay to perform at a high level with a lot of volume, that is a lot of activity, if your form is correct. If your form is not correct, then that can cause more wear and tear and problems down the line. Number three is a traumatic event. So this could be something like a lifting injury, either in the gym or at work, a car or bike crash, or a sports injury. That's pretty obvious why you would have back pain after something like that. Number four is posture. So oftentimes back pain, especially if it lasts a long time, is due to our everyday habits. So if you think about it, if you're sitting, standing, or walking incorrectly, you're doing these things all day, this could cause back pain. All right, so let's get into the anatomy. There are three anatomical reasons why you may have back pain. Number one, the muscles may be tight. This could be in the back or in the hips. So these muscles in here could be tight, or the muscles more commonly in the hips. It's usually not your glute max, which you probably know that one, but it's probably the one of the muscles under it. So we have something here called the piriformis you may have heard of, and there's a whole bunch of other little muscles in the hips, as well as muscles kind of on the side here, and the IT band running right down this way. If any of those things are tight, that can cause the joints in the section of the body next to it, which is the lower back, to be loose. The body will compensate. So if one area of the body is too tight, let's say it's the hips, then the back may loosen up to compensate. And so this area would be too loose. And you don't want your joints to be too loose. If they're too loose, that can cause pain, especially because we have a ton of nerves coming out through here, as well as ligaments and tendons. So if these bones here are too loose, they can cause stress on either the ligaments, tendons, or the nerves, and that can cause pain. Number two reason why you could be having back pain, your bones may be too tight or stiff. And that could be the bones in here, that could be the bones down here, especially in your hips is very common. They could be too tight. And actually that's a slightly easier fix than the muscles being too tight, is the bones being too tight. We can usually loosen that up. A lot of times what happens with bones is they have all of this connective tissue around them, and you got to kind of loosen up the connective tissue in there. So if this is getting too thick, the bones can be too tight. If the bones here are too tight, or even up here too tight, that can cause problems in the back. Number three, the muscles may be weak or not activating properly. So we have a ton of muscles here. Some of the most important muscles for keeping your back in check are muscles such as your glutes right here and here, as well as your core. And it's not the core that you think of. It's not the six-pack abs. So here's the six-pack abs, not those ones. We're actually looking at the deeper abs. It's called the transversus abdominis. This muscle stabilizes the spine. It wraps all the way around, and even under here, stabilizes the spine and makes it so it cannot shift around too much. If the spine shifts around, that's when problems arise because there is now stress on the nerves, tendons, or ligaments. So we need to make sure that these muscles are strong. And what the glutes do is they keep your pelvis where it should be. So your pelvis can rotate a little bit, either forward or back. If that is the case, then it can cause stress on the back. This muscle right here, let's try to isolate that one. This muscle actually helps to maintain the stability of your hips. So if this muscle on either side isn't strong enough, what happens is one side of the hips will fall a little lower. And what happens there when this side would fall lower is that the lower back will now be a little curved because everything isn't in line anymore. And so things like this are things that we need to look at. A lot of times people do have the strength, but the muscles just aren't activating properly. And so we need to use muscle activation techniques to fix that and wake them back up, basically. Now, it's important to realize that there are two different types of people, and oftentimes people will have both things going on, but sometimes people are too tight, sometimes people are too loose, and we need to treat accordingly. So some people need more flexibility, some people need more stability. Most likely, it's a combination of all of these things. It's also important to understand that everyone is different and that your back pain may be due to different things than someone else's back pain. So the way that we treat your pain is usually unique to how we treat someone else's pain. This is why I can't give you an exact formula right now on how to solve your pain without evaluating you. Everyone is different. As you guys know, Better Life Health and Wellness specializes in low back pain. It's the most common diagnosis we see. Right now, we're running a free Total Body Diagnostic Visit where we'll look at your whole body as well as take an in-depth look at your specific problem. We then use hands-on therapy techniques to decrease your pain, and then what we'll do is we'll stabilize in that correct alignment and position to keep you that way and to keep you out of pain. Feel free to message us on social media, call or text us, or submit a contact form on the website, and we are happy to help. We're here to help as much as we can. Any question at all, send us a message. Again, I'm Dr. Corbin Pominville, and thanks for tuning in.